In these video series, the muscles of the pectoral and scapular regions will be reviewed. The muscles are arranged in two groups, the anterior group and posterior groups. The posterior group is further subdivided into superficial, deep, and intrinsic muscles. The muscles of the anterior group are 4 in numbers. These are pectoralis major, pectoralis minor, subclavius, and serratus anterior muscles. Pectoralis major is a fan-shaped muscle that covered the superior part of the thorax. It has clavicular and sternocostal heads. The clavicular head has its proximal attachment on the anterior surface of the medial half of the clavicle, while the sternocostal head is attached to the anterior surface of the sternum, superior 6 costal cartilages, and aponeurosis of the external oblique muscle. The two heads blend distally and attach to the intertubercular sulcus of the humerus. Pectoralis major is innervated by both medial and lateral pectoral nerves. Pectoralis major is a strong adductor and medial rotator of the arm. Acting alone, clavicular head flexes the arm while sternocostal head extends it from the flexed position. Pectoralis minor lies underneath the pectoralis major, and it is triangular in shape. Its base is attached proximally to the 3rd to 5th ribs near their costal cartilages, while the apex is attached distally to the coracoid process of the scapula. Pectoralis minor is innervated by medial pectoral nerve. It stabilizes scapula by drawing it inferiorly and anteriorly against a thoracic wall. It also assists in elevating the ribs for deep inspiration when the pectoral girdle is fixed or elevated. Subclavius muscle is a small, round muscle that covered the inferior surface of the clavicle. It is attached proximally to the junction of first rib and costal cartilage and distally to the inferior surface of the middle third of the clavicle. It is innervated by nerve to the subclavius. Subclavius muscle anchors and depresses the clavicle, stabilizing it during movements of the upper limb. It also prevents clavicular dislocation at the sternoclavicular joint, for example, when pulling very hard during a tug-of-war game. Serratus anterior muscle is a thick, broad sheet muscle that forms the medial wall of the axilla. It derives its name from sawtooth appearance of its belly. Its proximal attachment is on the external surfaces of the lateral parts of 1st to 8th ribs, and distal attachment is on anterior surface of medial border of scapula. Serratus anterior is innervated by long thoracic nerve. It is a strong protractor of the scapula and is used when punching or reaching anteriorly, otherwise called boxer's muscle. It also holds the scapula against the thoracic wall when doing push-ups or when pushing against resistance, such as pushing a car. The inferior part of the serratus anterior rotates the scapula, elevating its glenoid cavity so the arm can be raised above the shoulder. Injury to long thoracic nerve may occur during knife or bullet injury to the thorax. This results in paralysis of serratus anterior and characteristic winged scapula, especially when the outstretched upper limb is pressed against a wall. In winged scapula, the medial border and inferior angle of the scapula moves laterally and posteriorly away from the thoracic wall when the arm is raised. In addition, there will be inability to elevate the upper limb above the horizontal position. If this video is helpful, consider subscribing to this channel.